When do you think cancers grow? In a 24-hour period of the day. When do you think they grow? Daytime, afternoon, typically, right, 8 to 4, because that's typically when the chemotherapy places are open. What do you think? No? Okay, all right. When do you think they grow? Nighttime. So kind of interesting, because you know why? Because your body's at rest. Your body is really smart, right? During the day, you've got a lot of environmental exposure. You've got the sun with its radiation. You've got the environment that has its own environmental toxins. So your body is really equipped to kind of handle that. And so the reduction of mitotic or adverse growth is pretty significant during the day. Your body's kind of fighting it. During the day, it says, hey, I'm tired. I'm going to shut down. Well, that's the time that cancer cells kind of say, I'm good. Let's start growing. When we look at metastatic ovarian cancer, metastatic breast cancer, people getting cisplatin, doxorubicin, the highest amount of growth of the cancer cells typically starts around 10 o'clock at night and peaks at around 4 in the a.m. Not a lot of people getting chemotherapy around 4 o'clock in the morning, right? In fact, the Block Center is the only center now in the country that does this chronomodulated therapy. Talk to your oncologist about them. Let them look it up, because the studies on it are significant. Because not only does it appear to improve the efficacy of the drug, the need to reduce your dosage is 80% less because of side effects when it's given at that time. There is a 4 times greater survival rate over a 5-year period with chronomodulated therapy. And drugs that you've already been given that they tell you, and they're right, they don't work anymore. Look, we've checked your PET scan, we looked at your CT scan, and there's further growth. Now can be used because your body's in a different frame. So this may be one of the more significant interventions out there. I mean, just right like crazy, simple, like thinking outside the time frame. I'm an ER doc, right? We don't close at 4 o'clock in the afternoon. Because guess what? The most common times for people to get heart attacks, 6 in the morning. I don't know why. Well, maybe. Maybe that's why. Flax. Anyone eat flaxseed? Ground flaxseed? All right. Everybody should. Ground flax it has 800 times the amount of rich phytoplant-like antioxidants than any other food. It's also, it acts on the gut-liver metabolism, so it improves flow through the liver. It's a great fiber, kind of gets rid of things. 30 grams a day gives you enough fiber. Typically, 30 grams a day will give you enough fiber for the day. 30 grams a day tends to be about a tablespoon and a little bit more. 2 tablespoons will give you 50 grams, which is a lot. Again, running things through. Vitamin D. How many take vitamin D? Awesome. So vitamin D is like thyroid medication in that you just don't take thyroid medication and leave it. Like I don't just say, oh, you got thyroid problems? Here, let me give you, 60 micrograms of levothyroxine or 90 milligrams of porcine thyroid. I check levels, right? You check levels to make sure you're okay. Same thing with vitamin D. Vitamin D, everybody's absorption is different. So if you take 1,000 units of vitamin D, that may be okay. What's okay? What we think is okay, and what we've seen in the research, is that optimal levels of vitamin D are probably between 60 and 80. Normal levels are 30 to 100. Normal is not necessarily optimal. Melatonin. Melatonin is your friend. Melatonin seems to decrease fatigue, decreases hair loss, decreases nausea and vomiting, and there is no safety concern. Probiotics. I love probiotics. They're awesome. If we look at patients that have undergone operations and we give them probiotics pre and post-op, it reduces infections, complications, hospital stays, antibiotic therapy by anywhere from 45 to 50%. It reduces the onset of diarrhea from chemotherapy by 50 to 60%. Acupuncture is truly a remarkable modality. Traditional Chinese medicine as well. There are studies that have looked at traditional Chinese medicine and standardized chemotherapy together, and the efficacy of putting them together showed improved survival and reduced morbidity. So thank you so much for listening, and whoever wants to stick around for some questionings, I'd be happy to entertain.